Hello and welcome back. This is our third installment of the COVID-19 considerations for pharmacists and pharmacies. And much like everyone else, it's been a while since we've recorded this because we've been through some transitions. But today we're going to be talking about COVID-19 testing and some guidance that was recently issued by HHS. My name is Erica Ash, and as always, I'm joined by my colleague Wakaba Tessier.
Hi, Erica. It's good to be here. I think it's been a really long time since we recorded our second recording related to this topic, and even more has changed now. I think the last recording, Erica, was in our studio, right? Still in Kansas City.
Yep.
And now I
And
am
this
now,
time we're both in our homes.
and I'm in the bedroom actually while my kids watch Avengers on Disney Plus in the living room. So a lot has changed, but also a lot has changed in the pharmacy world. We've seen a lot of waivers come out from each of the boards of pharmacies, which we are tracking. But we wanted to talk specifically today about HHS guidance related to pharmacists' ability to order and administer tests, and then also relatedly, HIPAA enforcement discretion about community testing sites.
So what Wakaba and I are going to be talking about today is the HHS guidance and HIPAA waiver that was released on April 8th for the guidance and April 9th for the waiver. And these just allowed pharmacists to, one, perform the test, and that's what the HHS guidance is about. And the HIPAA waiver was about kind of waiving certain conditions for these community-based testing sites. And some other really important considerations that we're going to talk about are a CLIA waiver, which is something that you might need to have in place if you're going to do these tests, the Board of Pharmacies guidance and other legal considerations. And then finally, we're going to just talk about some general business considerations you might want to think about before opening up your pharmacy to become one of the testing sites. So we wanted to start off and talk a little bit about what this guidance and waiver specifically said. And Wakaba and I recently wrote a blog post about both of these when they came out. So Wakaba, can you start by just telling us kind of what this HHS guidance does and what it says?
Sure. So this guidance came out on April 8th, and it said that HHS was authorizing pharmacists to, quote, order and administer COVID-19 tests, including serology tests that the FDA has authorized. It was interesting because it noted that most Americans are relatively close to a retail pharmacy and that they interact with pharmacists more frequently than other healthcare professionals. So, as we alluded to in our last recording, Erica, we had mentioned that perhaps pharmacies and pharmacists are going to be on the front lines of COVID-19, not only testing, but really the fight against this pandemic. And I think HHS finally caught on with what we were saying the last time. But this guidance, Erica, also talked about immunity under the PrEP Act. And can you tell us a little bit about what that PrEP Act is?
Definitely. So the PrEP Act authorizes the Secretary of the Department of Health and Human Services, or HHS, to issue declarations that provide kind of a broad immunity from liability. And this liability is from any loss caused or rising out of, related to, or resulting from the administration or use of a countermeasure to diseases, threats, or conditions determined by an emergency declaration. So, and this liability not only applies to federal liability, but also to liability arising under state law. So, for example, negligence is a common cause of action that's going to arise out of state law. So, if there was a negligence suit for how a pharmacist was administering one of these tests, then that would be protected. The pharmacist would be protected under this PrEP Act declaration. So the protection and immunity from liability is really broad. And then, so one thing though that it's important to note is that this order did not specifically talk about billing and reimbursement. So that is going to remain unchanged. So all that it really protects pharmacists from is from liability for administering the test, not for any billing issues.
Right.
And Wakaba, can we talk about next the HIPAA enforcement discretion and what exactly that means?
Right. So this one, the OCR announcement came the following day on April 9th after the HHS guidance. And I will say this is probably a reaction to some of the bigger chain pharmacies like CVS and Walgreens setting up COVID-19 testing sites. So I think this is essentially sort of a after the fact pronouncement based on all of the activities they've seen with these large pharmacy chains. But what HHS or Office OCR said that they were going to exercise its enforcement discretion and refrain from imposing penalties for violations of HIPAA for covered entities or business associates that participate in good faith in the operation of COVID-19 community-based testing sites or CBTS during this public health emergencies. They did say, and I think it's because a lot of the drive-through testing sites, you're going to be able to see people in the car. You may recognize people who are driving through and getting tested. They did say, though, that there are certain safeguards that covered entities and business associates had to put in place. And so they reminded people to, again, use and disclose only the minimum protected health information, to set up canopies or similar opaque barriers at CBTS to provide some privacy to these individuals during the collection of samples, and then controlling foot and car traffic to create adequate distancing at the point of service to minimize the ability of persons to see or overhear screening interactions at a CBTS. The other interesting thing was that they specifically said that the notice does not protect covered entities or business associates from enforcement actions when those entities are performing non-CBTS related activities. So, for example, a pharmacy that participates in the operation of a CBTS in the parking lot of its retail facility could be subject to CMPs for HIPAA violations that occur inside the retail facility at that location that's unrelated to the CBTS. So this isn't a blanket waiver of HIPAA enforcement actions, but rather it really just focuses on those CBTS sort of drive-through, mobile, maybe in the parking lot testing activities.
So Wakaba, if let's say a pharmacy is conducting one of these CBTS in their parking lot, and there's just a ton of cars in the parking lot, and there's a line around the block, and they're just kind of going from car to car testing people, could that be considered unreasonable because maybe you should have scheduled the patients or had more space between cars? Is that what they mean by reasonable protective measures?
I would think so, yes. I mean, a lot of these testing sites, based on our research, right, is that first of all, you need to fill out a questionnaire to see if you're even eligible to get these tests done. I know that the CVSs and the Walgreens of the world have worked closely with either HHS or each of the states. So they've been working in conjunction. And so it's not that they're open to the entire public. And I don't know if they are scheduled, like you said, but having a reasonable amount of people drive through and not having them in line for a really long time, I definitely think fits at least the example that HHS noted in that enforcement discretion announcement as a reasonable safeguard. Okay, so next we're going to talk about CLIA waiver. But first of all, we need to talk about why are we talking about CLIA? When I think about CLIA, I think about labs, right? Because labs need to get CLIA certificates. And so why are we talking about a CLIA waiver? Well, when we first saw that HHS guidance, we immediately thought of point of care tests, like those strep throat tests where you put a swab in your throat and they collect the sample, and then you find out within 5 minutes whether you have strep or not, or like a UTI test. So that's kind of what came in mind with respect to these COVID-19 tests. And we thought that if these COVID-19 tests that HHS is saying that pharmacists can now order and administer, then we thought, well, maybe we do need a CLIA waiver. But first of all, Erica, can you tell us what CLIA is and what is a waive test and why might we get these CLIA waivers?
Yeah, so CLIA stands for the Clinical Laboratory Improvement Amendments of 1988, and they were originally enacted to just make sure that all clinical laboratories were kind of following the same guidance and that you're going to get similar results for tests performed at different laboratories, just as a quality type measure. And so, what a wave test is exactly what you were talking about, Wakaba. It's kind of an easier point of care test that the manufacturer will give you a set of guidelines and you just run the tests according to these guidelines. And if you do have a CLIA waiver, it's important to note that you cannot kind of go off the rails and do whatever you want with these tests. You have to run them according to the manufacturer's guidelines. So essentially that's what a waived test is, but you still have to get what's known as a CLIA waiver. And so this CLIA waiver is you use the same form, which is the CMS form 116, to get this, and that's what you fill out for your certificate of compliance or your CLIA waiver. And that just essentially allows you to do these waived tests. And so the U.S. Food and Drug Administration, they recently clarified that when they grant emergency use authorization, COVID-19 tests have for the point of care test, then they're deemed to be CLIA waived. So you're still going to need this CLIA waiver.
And so when we were talking earlier and I said, we just assumed these were CLIA waive tests, it's because I guess when we were talking, we thought that these COVID-19 tests were going to be those, like, I think in the news we see Abbott and those like 5-minute point of care tests where you take a swab and then you get results within 5 minutes. So that one would be an emergency use authorization, and that would be a CLIA waived test, right?
Exactly. And it's also important to note that if there's new tests and they haven't received this emergency use authorization and have been reviewed by the FDA and have that kind of stamp of approval, then they don't receive this CLIA categorization and you can't do them if you only have a CLIA waiver.
Oh, so then you'd have to get maybe potentially a more higher complex CLIA certificate as opposed to a waiver.
Exactly.
And have there been any like CLIA, well, I guess not CLIA, but waivers that have been issued by CLIA that may be applicable to pharmacies that might be considering getting these waivers?
So far, there have been no waivers to the waiver, if that makes any sense. However, how the process usually goes is you fill out what I talked about before, the CMS 116. And then each state has its own CLIA office. So you're going to send it to your state-specific CLIA office. And it's also important to think about, as you're doing this, if there are any requirements above the CMS 116 that would be kind of state-specific. So you send it in, and typically how it works is then they would issue you a CLIA number and send back your certificate. And then at the point when you receive your certificate in the mail, that's when you can start performing these tests. But what they've waived now is essentially you don't have to get the certificate in the mail. As soon as they authorize you to do it and give you your CLIA number, you are good to start performing the test, but you still have to comply and send in the CMS form 116. So Wakaba, I know that you're really familiar in dealing with boards of pharmacy and some legal considerations when pharmacists are getting licensed and pharmacies are getting licensed. What sticks out in your mind when you heard about these orders that pharmacies should be paying attention to?
Yeah, so one of the first things I thought about was the scope of practice of a pharmacist. And actually, I said earlier that we were tracking some of the Board of Pharmacy waivers and, guidance that the boards have issued. And actually in Nevada, probably it was like mid-March, they talked about the scope of practice of a pharmacist, and they actually said that the pharmacist can, I think it was like essentially collecting specimens was within the scope of a pharmacist's practice. And so when I saw that HHS guidance, the first question that came to my mind was, well, what does order and administer mean? Does that just mean, like the point of care testing that we talked about, where they're just essentially swabbing, maybe your throat, or your nasal passage and then administering the test? Is it specimen collection? So that's something that I, immediately thought about, and it might be worth it to inquire with your board of pharmacy related to what does order and administer mean from your state perspective, because what you don't want to have happen is you don't want to go out and start collecting specimens or administering these tests, and then all of a sudden you're outside the scope of your practice. Another thing I thought about was, well, are we ordering and administering these tests within the pharmacy license space? Erica, some of the guidance we've seen related to this has specifically said that pharmacists can go out and perform these COVID-19 specimen collections and tests, but outside of the pharmacy license space. So that's also something to keep in mind too. And as we talked about, the large chain pharmacies like your CVS's and your Walgreens are doing these CBTS activities, but we've all seen them as a drive-through activity, which is outside of the actual physical pharmacy space. So these are things to keep in mind if you're thinking about entering into this space. And again, it was just last week that the guidance from HHS and OCR were published, and so we're seeing a lot of activity related to what pharmacists can and can't do within what space. So it's certainly something to keep an eye out. Other issues, I think, Erica, you were identifying were state reporting obligations.
Yeah, definitely. I know in Kansas, which is our firm is pretty close to Kansas, and some other states have persons of interest reporting obligations or persons under investigation. And so when you think someone might have COVID-19 and you're actively running testing sites, you have certain reporting obligations. But some states, it's only when it's confirmed. So it would be really important to know when, if you're running one of these sites, you have to report to the state or, your local Center for Disease Control, what if the person has COVID-19. Another thing that, Wakaba, I know we've done some projects for clients in the past was medical record retention as well. And so if you are, testing patients, what are your obligations with medical records, both creation and retention?
Right, especially with these point of care tests when you're getting these results right then and there, right? It's one thing to be collecting specimens and then sending it to your the lab with which you have a partnership, but it's another thing when you're actually doing this point of care test and you're able to get these test results right away. Then what do? I think you have an obligation to create some sort of medical record saying what test was performed and then what the results were, and then ultimately, as Erica pointed out, you may have a state reporting obligation. You certainly would have an obligation to the patient as well as the patient's physician.
And Wakaba, we talked about this in the past, but in the past slide about how the guidance was silent on reimbursement and billing. And so what are some issues that you think that could come up with reimbursement and billing compliance?
Right. So, the guidance specifically said that that their past guidance related to the fact that pharmacists are not an independent provider and that they can't enroll separately as a provider under the federal healthcare programs was unchanged. So that guidance didn't affect that. So one of the first things that came to my mind was, well, how are you going to bill for this? If the pharmacy is already credentialed with a third-party payer, and it could, private or Medicaid, it's definitely worth it to call and see how that's being reimbursed. But I think another thing to keep in mind too is that to the extent that you have some sort of agreement, like a provider participation agreement with your third-party payer, then it's important to review those to see what kind of obligations that you have that you might not be aware of, because this is something so new that pharmacies probably don't do on a day-to-day basis.
That makes sense. And our last point was just about communicating with patients and making sure that patients know what's going on, because all of the boards of licensure have certain requirements, and one of those is that you can't abandon your patients once you establish it. And if you are going to hold your business open at certain times, typically, what you have to give notification to the board of pharmacy if you're not going to do that. So it's so important to be communicative. If you're not able to maybe perform the test, maybe you can't get enough PPE to do it, maybe you don't have enough staff members to do it. So just kind of communicating with patients and the board of pharmacy if anything changes. So obviously, while there's important legal considerations to think about, more than ever, I think right now everyone is thinking about business considerations, across the spectrum, not just at pharmacies, but really in this whole economy right now. So just with talking about, starting this COVID-19 testing at your pharmacy, there's some things that you're going to need to think about. And one of the first that comes to mind is just the cost of starting up the CBTS. As we mentioned in that HHS guidance, you have to purchase certain screens to make sure that you have a level of privacy. If you don't already have a way to keep a medical record, because maybe you only have a pharmacy system and not a record with the capabilities to store the testing results, you would need to think about that as well. So I think that there's a lot that could go into starting one of these, and just to really think about, okay, what do we already have? And then what is going to be a cost over and above that? And one consideration that Wakaba, I know you had mentioned, is insurance.
Right. So, you talked about that PrEP Act, right, and how it was sort of broad, but I don't think it necessarily stops people from bringing a lawsuit against you in case something goes wrong. And so you still need to spend the money to defend that lawsuit, I'm assuming, until, you can go into court and say, no, I'm immune from these claims. And so one of the things that you should probably check is your liability insurance and what does that insurance cover. Some states too, Erica, like Ohio, have said that pharmacy techs can perform some of these ordering and administering of COVID-19 tests in specimen collection. And in those instances, I think we need to understand really what is the scope of the tech's work, and then whether or not insurance will cover their work. I think too, if a CBTS gets overwhelmed, I think you still need to keep in mind that pharmacists ultimately have the authority to oversee the work of the techs. And so from a liability insurance risk perspective, that's something to keep in mind if you want to start up a CBTS. And then in terms of the CLIA waiver, we talked a lot about what it is, why it's applicable, do you need to get one? But what if you decide, okay, I have the cost to start a CBTS, I'm all set on liability insurance. Well, how long, Erica, does it actually take to get a CLIA waiver these days?
Yeah, and that's a great question, right? Because if so many people are applying, you would think the system might be backlogged even. I know in Missouri, for example, they have 30 days to issue your CLIA waiver, but you don't know if maybe people are out of the office, and so that could be a real consideration. If it's going to take 30 days just to get this waiver in place, then is it worth it to go out and buy all of the testing equipment and to up your liability insurance? It just it would be really dependent. So already having that waiver in place, though, that might be an additional consideration or a reason why you might want to do it.
And
then another.
I was going to say, we've worked with clients who already have CLIA waivers, specifically pharmacies that already have CLIA waivers that were doing other point of care tests that they could simply, they already have that in place. So you could use that waiver to cover this point of care testing for COVID-19.
Exactly. And related to kind of doing these tests and, how widespread it might be, also thinking about drawing people into your pharmacy space, which, could be a good thing or a bad thing, depending. If you're obviously advertising that you're doing COVID-19 testing, it might make people kind of hesitant to come to you if you have a really big retail business otherwise, or if they get other medications from you, the perception, I guess, of how easily this disease is spread. And Wakaba, do you have any other thoughts about drawing people into the pharmacy and any liability that could.
Yeah, so I think in our last webinar, we talked about ways in which pharmacies could try to slow the spread. And one of the things we talked about was making sure that you have maybe just do drive-through only, or delivery of the medications. I think it's kind of the same idea, is that if you were going to do these CBTS tests, what is the setup going to be? Is it that, like the CVS's and the Walgreens, is it going to be a drive-through testing site? Or are you doing this in your pharmacy, kind of like those minute clinics, right, at CVS, where you walk in and you get tests? What is it going to look like? And then there's also that question of the guidance that's been released by the boards of pharmacy that say, okay, you can do these COVID-19 tests, but it has to be spaced outside of the licensed space. So these are things to start thinking about too if you're going to do these CBTS tests.
And I think what's been on everyone's mind, or at least I feel like I hear about on the news nightly, other than ventilators, is access to personal protective equipment. It's already so limited. So how is your pharmacy going to get access to the necessary equipment to test people?
That's right. Absolutely. And it's some of our clients who have the capability, though, have been like 3D printing some like masks and stuff. I know in our neighborhood, people are talking about sewing masks, but that's definitely a consideration. Do you have enough PPE to actually do this? We've been talking a lot about starting up your own CBTS, but there could be other partnership opportunities, like to the extent that your board of pharmacy has said, okay, collection of specimen is within the scope of a pharmacist in your state, and you have the capabilities to collect these samples, you might consider partnering with a lab, right? That where you are the ones who collect the samples and then you send it along to the lab. And then you're not doing point of care testing. And maybe in that situation, you might not need a CLIA waiver.
That makes sense. And with that, even, just specimen collecting, you also should think about the risk of exposure to potential employees. If you have, obviously, if you only have one pharmacist and they're your pick, and let's say techs aren't allowed to collect specimen for whatever reason, if your pick goes down, that could be a real issue, obviously, because then you wouldn't be able to keep your pharmacy open if you can't have a pharmacist there. So that might be something that you think about as well, only having certain staff members staff it and how you're going to protect them. And if you have any backup options in case something does happen.
So certainly, Erica, that guidance that was published by HHS related to the pharmacist's ability to order and administer COVID-19 tests was definitely a step in the right direction with respect to recognizing pharmacists as independent providers and being able to independently enroll as a provider in the federal healthcare programs, as well as other third-party payers. But I think our original reaction when that came out was great. This is a step in the right direction. But as you've heard in our recording today, there are a lot of other issues that it didn't address. And so if you are thinking about setting up a CBTS, or if you have questions related to scope of practice of pharmacists or pharm techs, please feel free to give us a call. We'd be happy to help. And hopefully we can fill in the blanks that HHS guidance did not address. So thank you again for listening. Again, I'm Wakaba Tessier, and I was joined by my colleague Erica Ash. If you have any questions, let us know. Thanks.